This patch is used to relieve minor aches and pains in the muscles and joints, such as arthritis, backache, and sprains. Menthol in the patch creates a cooling and warming sensation on the skin, which helps to distract from the deeper aches and pains in the muscles and joints. It is recommended to apply the patch to the affected area for relief. The patch is for external use only and should not be applied to open wounds or damaged skin. It is important to follow the recommended daily dosage and to apply the patch at the optimal time for the best results. When using this medication, apply it only on the skin that is clean and dry. Remove the backing from the patch and place it on the affected area. Do not use it on skin that is injured, irritated, or has a rash. Leave the patch on for up to 12 hours as directed by your doctor or the product package. Take it off before bathing and do not apply it right after bathing. Do not bandage or wrap the area unless directed by your doctor. Avoid applying heat to the patch as it may increase the risk of side effects. Remember to wash your hands after handling the patch and avoid getting the medication in your eyes, nose, or mouth. If it does happen, flush with plenty of water. After removing each patch, fold it with the sticky sides together and throw it away in the trash out of reach of children and pets. If your condition lasts for more than 7 days, gets worse, or keeps coming back, talk to your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience redness, mild itching, or irritation at the application site, it's important to let your doctor or pharmacist know. Your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, if you notice blistering or swelling at the application site, or increased or unusual pain, stop using the medication and contact your doctor immediately. While a severe allergic reaction to this medication is rare, seek medical help right away if you experience symptoms such as rash, swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Before using this product, make sure to talk to your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. Also, be sure to inform your doctor or pharmacist about your medical history before using this medication. And if you have upcoming surgery, let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are scheduled for an MRI test, it's important to inform the testing personnel if you are using this patch, as some patches may contain metals that can cause serious burns during the MRI. Your doctor can advise you on whether you need to remove the patch before the test and how to do so properly. If you are pregnant, only use this medication if it is clearly needed, and discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions when using the Icy Hot Advanced Relief Patch. This means that it could affect how your other medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. This will ensure that you are using the patch safely and effectively. Always consult with your healthcare provider before using the patch. If the patch is chewed or swallowed, it can be harmful. If someone has taken too much of this medication, remove the patch if possible. If serious symptoms such as passing out or trouble breathing occur, call 911. Otherwise, call a poison control center right away. If you are in the US, you can call your local poison control center at 1-800-222-1222. If you are in Canada, you can call a provincial poison control center. Make sure to keep up with your regular medical appointments and any lab appointments as well. This will help you to monitor your progress and make sure that the medication is working effectively. If you are using the Icy Hot Advanced Relief Patch on a regular schedule and miss a dose, use it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Use your next dose at the regular time. Do not double the dose to catch up. When storing this medication, it is important to keep it at room temperature. Be sure to check the product package for specific storage instructions, as different brands may have different needs. It's also crucial to keep all medications out of reach of children and pets. When it comes to disposing of this product, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Be sure to properly discard the product and it is expired or no longer needed. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.